So you're here today to ask us, or allow me to ask you, for future people that are kind of come into my clinic, what was your expectation initially when you heard there was a route for you to get something that wasn't going to gag you to death? Because that was one of our biggest struggles we went with initially. Was you had a pretty prolific gag reflex. You had dentures in the past, and if I understand, it was something you more or less tolerated, correct?
Yes.
What was your expectation, knowing what you'd already been through denture wise, and you had some potential snake oil salesman telling you that there was something else on the horizon?
Excited at first, nervous because it is dentist.
Yeah.
I was always nervous about dentists just because I've always associated them with pain. Then after I got here, you talked to me and relaxed me in the first day. It's been pretty good since.
Had you had anyone talk to you about implants in the past? Is it something on your radar at all?
No, not at all. Even when I went to the other dental place to relay, they didn't even bring it up. They just pushed me in and pushed me out with the dentures.
How was your experience with your dentures with the gag reflex that you had?
Oh, it sucked completely. I couldn't even wear the top ones and the bottoms and ones at the same time. So,
how was eating in that situation?
Non-existent at all.
So you had a pair of picture dentures.
Yes.
Okay.
They were just for cosmetic. So,
how have these been? I know, and full disclosure on my end, we've gone through some adjusting and figuring things out together. Because you were without teeth and or appliances for how long before you came and saw us?
years, completely 8 years.
So we went through a whole lot of just relearning everything.
Yes, absolutely. The eating part is awesome. I've been able to eat what I want, pretty much when I want.
So we've got you eating again. You didn't really have an idea about implants until you came in and you talked to me. And as far as the procedure and process goes, we tried to make sure you didn't have to associate pain with this, in terms of we went through our sedation modality. How did that work as advertised?
Absolutely.
Okay.
Absolutely. I don't remember. I didn't feel anything. I was sore for like 3 or 4 days afterwards.
The soreness, how would you compare that to when you had your extractions completed initially? I guess that was 8 years ago.
Comparison.
No comparison.
Yeah, there's no comparison to even having a toothache compared with the pain that.
A positive comparison.
Positive.
Yeah.
Absolutely.
we got to be clear for those folks who dislike folks like me. So we're a little over 1 month out. As if you were gonna give anybody a heads up about the whole process, what was or has been the most difficult part for you going through here, and would it keep you from doing it again?
Yeah. Honestly, nothing would keep me from doing it. Yeah. But the hardest part for me was slowing myself down to learn how to talk again.
Okay.
Because not having all that in my mouth. It was rough.
Yeah.
And when you're eating cheeseburgers, watch out for your cheese.
So, no regrets.
Absolutely no regrets.
Uphill battle of getting used to it is definitely evening out.
Oh yes.
Okay.
And I'm not as conscious as I was before, even when I was talking to people. I don't have to turn away when I'm talking. I can actually face you and talk and not feel like somebody's judging me because that I'm into it.
Well, I have to say, one, I'm honored that you trusted me with such an undertaking. We did 10 implants and transitioned you from nothing to everything. And while you sold yourself short on the difficulty, you took on an undertaking to retrain. So thank you for letting me be a part of your journey and process, and I'm looking forward to continuing it as we go forward.
Thank you.